In this fourth segment on sleep, we are actually focusing on clinically supported lifestyle correction for sleep disorders and Dr. Jolie Thomson's experiences on this subject. What is the difference between self-lifestyle correction and clinically supported lifestyle correction when it comes to managing lifestyle disorders?
This self-lifestyle correction and clinically supported lifestyle correction is both this has a very much difference will be there. In what way means the self-lifestyle correction, one person will be having some idea about what is good lifestyle and bad lifestyle, what is good food, what is good exercise, and so he or she will be going accordingly. If a healthy person it is doing that will be sufficient. If you are able to maintain your health, and that means if a person is having a healthy and not taking any medicine, no disease, means he knows how to manage his body and he knows what is good lifestyle. But if a person who's having a sickness and who is on medicine, means that he doesn't know really what is a good lifestyle, or even if he is knowing which is what is good lifestyle, there is some hitches is there which he is not able to understand his body parameters, which is or his genetic parameters, which is limiting him. If even some husband and wife was doing taking same food and same exercise, but one may be having one disease, the other may be healthy, or one may be having 3 or 4 disease and the other may be having another 3 or 4 disease or some common disease also, like diabetes and hypertension and arthritis. One person, the other person may be having diabetes, hypertension, fatty liver and kidney disease also. So that depends on one's genetics also. So we should, in the clinically supported lifestyle correction, the understanding of the doctor also is very important. If you go to a modern medicine doctor who is a specialist in diabetes, he will be looking into the diabetic aspect alone. And in the modern medicine, the problem is each specialty is so vast nowadays. The sleep itself is becoming a major specialty, and diabetes another specialty, heart disease another specialty, arthritis, rheumatism another specialty. So the problem is the patient will be having all this disease. What I am saying is the patient will be having so many disease, like the diabetes will be there, hypertension will be there, heart disease, and maybe dyslipidemia, cholesterol and triglyceride will be high, fatty liver, and even the liver fibrosis are set in. Along with that, there can be varicose vein or the peripheral vascular disease. And the kidney, diabetic patient and hypertensive patient, kidney may be already affected. So along with that, there may be sleep problem, taking medication for the sleep, and there can be joint pain and arthritis, taking medicine for that. So many medicines and so many diseases. And usually all the diseases will be dealt with by different specialists. So that is the problem what I am saying, and that is the problem that most of the patients, not to come one disease, not just for the lack of sleep or excess sleep, no one comes. They'll be having so many other parameters also, or the diseases also. So it has to be, in that case, you had to, in a holistic way, it has to be managed. In that, what we are doing, in my way of treating this clinically supported lifestyle correction, we do a detailed analysis of the patient's current health, even the body parameters. What is this, not only the calendar age, the body age also we assess. In most of the patients, the body age, especially those who are overweight, the accelerated aging will be there. And even this blood vessels clogging with the fat, actually this heart block, which everyone is hearing about the heart block and putting stent and bypass and all. It's actually the fat accumulation in your body, inside the blood vessel. In your body that we are taking, it's obesity. But when the fat is accumulated in your blood vessels, it is creating block. It is not creating your coronary arteries of the heart alone. It is actually, this change is happening inside your brain also. And we usually do this CAMT, that is this carotid artery media intima thickness, actually how much fat is depositing. That is because one of the big vein artery in the neck is called carotid artery. We can assess that thickness, and it is actually the vascular aging, and also it will give an idea about the circulation, the block in the carotid artery and the brain circulation. And it is very important for those who are having sleep apnea doing this test, because for the sleep apnea and snoring patients, this carotid, this atherosclerosis of the carotid artery is very common. The most important or the most relaxing or the relieving thing is, even if that is there, if you do the lifestyle correction, it can get reverted. Even though the blockers or the carotid artery atherosclerosis is there, block is there, it will, after 3 months, we repeat that. Usually after 3 months of lifestyle correction, we repeat it and see that there is a reduction in them. And even I have seen the patient with the calcification of the blood vessels or this atherosclerosis with the calcific point, it can get corrected. Calcification can be, but don't expect it in the next day. It will take some time, and also everything depends on the patient's following also. How much you are dedicating for your body, your time, your energy, your food control, everything matters.
Actually, in the case of the lifestyle corrections and all, when we mention it, you have said, like, lifestyle correction is something that is, when you are doing lifestyle correction for sleep disorder, it is not only sleep disorder, but generally all other parameters are also getting corrected with lifestyle corrections. So how do you say that these sort of lifestyle corrections for even any particular disorder is actually able to transform the life of that particular person from what he was earlier to something different? So how far is that possible?
See, when I'm talking about my experience, I have seen many patients, they may be taking 4 times insulin injections, or 3 or 4 times, depends, and 2, 3 or 4 diabetic medicine, but the sugar is not controlled. HbA1c may be 12, 14, even I had seen patients with 15 HbA1c, and most of them, this diabetic patients will be having hypertension, especially at least 4 or 5 years within. If they started diabetes, after within 4 or 5 years, the hypertension also will get will be there. And because of the medication, it will weight gain will be there, especially those on insulin and diabetic medicines, weight gain will be there. And many may be taking psychiatric medicines, so the weight gain is further. So with all these medicines, the patient is coming, but in my experience, within a month, most of this, especially for the diabetes, type 2 diabetes, we check whether it is a type 2 diabetes or type 1 diabetes. That is by checking the C-peptide level. Even if the person is taking insulin injection, we check the C-peptide level. If the C-peptide level is normal, then it is a type 2 diabetes. The pancreas is making enough insulin, is making, then you can stop. We actually, if the diabetes medicine, we stop at the first day itself. Insulin, how many you are taking also. Even 4 times insulin and 4 tablets, different type of tablet. So if it is type 2 diabetes and your C-peptide level, you can stop it. Only thing you should follow according to the dietary advice also. Your sugar is increasing only because you are eating more sugar. It's a low calorie, low carbohydrate diet is given. But ensuring for all the nutrition is there. Like there are 57 nutrients, including oxygen and water. Oxygenation also very important, because if you want to metabolize the fat, or if you want to get rid of the excess fat in the body, you need more oxygen. It is hydrocarbon, so more oxygen, then only you can metabolize it or burn it out. So you had to increase the exercise also. or the circulation also has to be. So special pattern of circulation which will increase the circulation to all part of the body. Actually, there is around 250 bones and 650 muscles in our body, and all should be getting given exercise. Then only the whole part of the body will be oxygenated, and also metabolism will be increased, and the fat also will be removed. Excess fat also will be taken as a toxin. And also we have seen that especially those with the sleep problems, these heavy metals like this mercury or even tin, lead, etc. can be positive also. High level will be there. With this correct exercise and correct food pattern means that you should ensure all the nutrient in the food as according to the, including the fiber or 14 vitamins, 14 minerals, or the essential amino acids and the fatty acids should be there. Omega-3, 6 balance and all is important. And also the toxins getting into your body, this food additives and should be avoided. And also there may be food which may be your body may be reacting. There are tests to check that also now. So if you may be taking this wheat and you may be having a gluten allergy, wheat preparation like maida, those things, or the bread, and it's all made of wheat. So if you have a gluten reaction, that itself, if you are allergic to or intolerant to gluten, if you are taking a meal with this wheat bread and all, your sleep will be affected. And we have seen that in our part of the country, the major food is actually staple diet is the rice. There are people who are having rice intolerance or allergy also. That may not manifest in as an itching or anything, but if such patients take that food and go to sleep, they won't be able to sleep. And even some vegetables, fruits, like the common this lady's finger, but not everyone. That is the problem actually. You cannot generalize which food has to be taken, which should not be taken. It's all depending on the person or the patient. So that in the clinically supported lifestyle correction, we have a protocol which is actually made to address a correct lifestyle to the patient is getting enough nutrient, enough exercise, and less toxins. That is our aim. If the patient is able to fit into that protocol, and the result will be very good. And how many, I had seen even patients with 30 tablets and all taking every day. Each day they are taking 30 tablets. And imagine a person who is around 70 years and taking 30 tablets, and to old people, to old senior citizens staying at a home around 70, 75 years and taking so many medicines. How can we, and already dementia set in, and how can we take it in the correct way? They may be taking in the wrong way, and the whole thing will be in a mess. The medication itself will be in a mess. And this old age and all, it is more dangerous to take so many medicines. And even the hypertensive medicine and diabetic medicine and insulin taking and going to sleep, they can get hypoglycemia or even hypotension. That's BP can go low, especially when they get up for going to toilet and all. So that is the reason for most of the fall in the toilet, night holes and breaking hip bone and all. One of the reason is that actually they are getting, because of the medication, they get a hypotension. The BP is getting low, and the brain circulation is not enough blood is, or the oxygen is not going into the brain, and they get in a blackout and falling.
Actually, when it comes to this lifestyle correction clinically supported for sleep disorders, what is the role of the patient support system? As you mentioned earlier, that they need to have an ecosystem where their sleep can be or sleep disorder can be overcome with lifestyle changes. So what type of issues do we face?
Yeah, that is the other family members' sleeping time. If a husband and wife is staying, and the husband is having night duty, or even he's coming back or the duty is over by 8 o'clock, but continuing with the TV and mobile, the wife won't be able to sleep. So the family members, everyone should make a discipline in going to sleep in the correct time, unless it is necessary for their job. not for as an entertainment. If entertainment should, if you are a family, if you have a family, if you have family married and or even the children. I had recently, I remember one lady who's having breast cancer and the fourth stage, and she doesn't want to go for surgery. Or actually, the breast cancer, the surgery and the chemotherapy and the radiation is the no. And she has worked with this palliative care and all, so she knows what is the implications of going for breast cancer surgery. And she has this lymph node swelling is there, lymph node involvement is there, and also this lung is affected, and some parotid gland also is affected. With this PET scan shows that increased activity. So she also having knowledge. So this person actually is diabetic and hypertensive also. And after joining for the program, it's here within first day itself we stopped with I think her HbA1c were 8.4, 8 or 8 point something in the initial stage, but within 2 months itself it was come down to below 6. So to the cancer patients, bringing down the HbA1c is very important. Actually, usually usual patients, if it's just a diabetic patient, we are asking them to come down below around 5.5. But if the patient is cancer also, asking them to come down the HbA1c below 5. So this glucose is a stimulant for the cancer cells. So when we are come to the sleep problem, this lady was also having the sleep problem. But her problem is her children comes at 1 o'clock or 1:30 only at home. So she is not able to, 10 o'clock she cannot sleep after that. And sleep is disturbed. Then I told them you had to make some arrangements so she will not be disturbed, because it is very important to get at least 8 to 10 hours of sleep, is especially a person who is having cancer, and for the recovery, or at least to what we are our intention is to at least it should be it should not spread, it should not go further. So this to make an arrangement for that. But they tried after the 3 months, they tried their best, and by the 3 months actually her diabetes is gone, hypertension is gone, she is very happy, no problem further. And even the PET scan was actually shown it's not gone. By that, you cannot expect the fourth stage cancer simply gone within 3 months or with the lifestyle correction. But she was totally healthy, no problem. And but again, when we are deeply asking her sleep problem, that children, son and daughter comes only at 1:30, and she is not able to sleep. And because of that, again, she has come down her HbA1c to 5 or around 5, but it has gone up also because of this sleep problem. That one thing we can do for such people is we should understand that with this electricity, before this electricity actually coming, we had biphasic sleep. Because when you look into the olden days of sleep habits and all, in India we all know that there is a this Brahma Muhurtam, and the people get up at 3:30 in the early morning, that special time. And usually in India they pray or do their meditation and such things. But even in the Western countries, in the Europe, especially in Britain and all, they call that is watch time. They also used to get up around around 2 o'clock, 3 o'clock time, and they do some household chores and like milking the cow and things. And then again, even they go to neighbor's house, and so it is there in the literature, the olden literature, or this the habit of people was there. So it is, and also many people think that getting up at this, the patients also say that the problem is I am getting it early at 3 o'clock. I am getting, but after that I am not able to get to sleep immediately. It takes a lot of some time to get back to sleep. That is, you should understand that is normal for a person. And this lady also, this cancer patient also, I had told her, you go to sleep at 7 o'clock or 8 o'clock. When you come, the children come, you can also get up and give them food or whatever. And after that, she can also take a second nap. That is what in the Western countries last time. After that, they go to sleep, and then with the sunrise, they get up. that is, you can follow that also. If that is one aspect of, I'm giving a tip for such people. So you can split it into two. Especially, it is always good you get up at that is in this Brahma Muhurtam and do some meditation, or that also definitely, that meditation and yoga has a positive impact on health. And after that you can go and sleep. And it is very common that you get up around 2 or 3 o'clock and you have a full bladder and you may need a toilet going, and then don't take it as a abnormal thing. Just take it as normal. Do some your exercises and meditation and prayers, and then go to sleep again.
With this, we come to the end of this fourth phase, the fourth stage of the discussion on sleep. And in this last stage, we were looking at clinically supported lifestyle correction and what are the possibilities there. Also, we understood that whatever are the medication options and surgical options and all that, basically the individual has a big role to play in correcting his lifestyle for improved response to sleep disorders. And additionally, the support of the family or the immediate members who are there along with the patient is also very important and crucial in helping the patient overcome sleep disorders. Thank you.